Okay, so welcome. Hi, I'm Doreen Tannenbaum, the Strategic Initiatives and Communications Manager with UCI's Procurement Services, and welcome to our departmental buyers training session covering SB 820, Regents Policy 5402, and Article 5 of the Collective Bargaining Agreement. Again, for anyone joining us today, the recording of today's session, along with the slide deck, will be sent out via email and is also available on the Procurement Services website by the end of next week. So we have training sessions available found on our website. You can find it at the footer of the procurement.uci.edu website. We have step-by-step training guides and videos available, as well as interactive courses on UCLC. If you would like to set up a one-on-one or group training session, please contact Shauna at n@uci.edu to set up that for the group or yourself, and if you need any further assistance. And I'd like to now turn it over to Snehal Bhatt, our Chief Procurement Officer.
Thank you, Doreen. Good afternoon, everybody. Thank you again for taking the time from your busy schedules to participate with us and engage in this training session. We are today going to talk about a topic that we actually already covered in April, but we felt like this is a very important topic. A lot of things happening right now, and this is getting a lot of scrutiny. And we thought that it might be worthwhile for us to have this session again. In addition to what we had already covered in last April, there is another element, SB 820, that we will also cover today, because that actually is even more critical and crucial for us to be aware of and to be mindful of as we are looking at doing our work and looking at getting services that are part of covered services. So we thought that it would be worthwhile for us to do this again. So again, welcome to this session. I'll just go over a little bit with the requirements of procurement overall, and then we'll go through some of the slide deck, trying to help you understand what are these different policies. They actually all essentially fall under the same umbrella of contracting out for covered services. So, it doesn't matter what you look at, SB 820 Article 5 of the Collective Bargaining Agreement or the Regents Policy 5402, all of them essentially are talking about contracting out for covered services. So they are all on the same topic. We will then have a Q&A session. So if you have any questions along the way, please feel free to put them in the chat, or you can also ask them after the slides have been presented. If you go to the next slide, Doreen. So for those of you who have been attending these sessions on a regular basis, this will be a little bit of a repetition, but I think it is very important for those who may be joining us for the very first time, for you all to be mindful of the policies. Just wanted to make sure that you all understand that procurement team is always here to help you. Many times you find us to be considered to be more of a roadblock, because we are trying to make sure that we adhere to all the policies and compliance requirements. But I also want to re-emphasize the fact that everybody, every employee of UCI, and for that matter UC, is actually responsible to comply with the policies. We are only here to help guide and make sure that we are all complying to the policies. So we try to stay on top of them and be the subject matter experts, but everybody on the campus is expected to follow and comply with all the policies, regulations, and rules. The policy that we all actually have to follow for procurement is a UCOP policy, BUS 43. Also, we have some specific policies for procurement that are on UCI 707-10 that actually also reference BUS 43. And then, of course, us being a state entity, we also have to follow the California Public Contract Code. One of the things that invariably happens, that a couple of things that I would like to also mention, is that there is delegation of authority that's been given by the regents to the president of UC system. and from there it gets redelegated to the chancellor and so on. One of the things you all need to be mindful of is that the delegated authority for signing any contracts for procurement lies with the procurement team. So please make sure that nobody from your units ends up signing any of the agreements unless they have been delegated the authority to do so. The other thing that I would like to mention, and we have been trying to work on this for a while now, we would like to continue to try and see if everybody can not actually get any services performed before the PO or the agreement is executed. It actually is against the policy for us to have somebody perform the work before you have the agreement or the PO in place. So we just want you all to be very mindful of that and make sure that you help us in making sure that we have these in place before you get somebody to submit, provide the goods or provide any services. These are just like overall elements. Now we'll go into specifics. For the 3 elements that we talked about, SBA 20 policy 540.5. At this point, I would like to actually turn it over to Leslie Kleiman, who is the Senior Director for Enterprise Workforce Relations at UCI, to talk a little bit about the policy, and then about how we act implementing the policy. So quickly.
Thank you, Snehal. Did you want me to, number one, can you hear me all right?
Yes.
Okay, would you like me to introduce myself and the team?
Yes, please, go ahead.
Great. So hi again, everyone. I am delighted to be back here with some of my favorite people discussing one of my favorite topics. Only part of that is true. You can guess which. So I'm Leslie Kleiman. My team runs labor and employee relations for all of UCI. Relevant to my team, we have Jeff Hughes, who is my lead for campus, and Erin Eckelman-Ray, who is our lead for health. So next slide, please. So just scrolling back a little bit and setting the stage. In November of 2019, UC and AFSCME had been in collective bargaining for both the SX, so that's a service, and the EX, the patient care technical units, for almost 2.5 years. And AFSCME, and the negotiations were really not going particularly well. AFSCME had begun at that point to articulate contracting out as its main issue. So up until that time, the collective bargaining agreements in Article 5 had basically, the university had reserved a lot of management rights in the area of contracting out. Basically, we were allowed to contract out for services as long as the contracting did not result in basically in job loss and people being laid off. And so AFSCME was extremely effective at the legislative level. And we almost ended up with a constitutional amendment that would have precluded the University of California from contracting out. So in an effort to do the right thing, to finalize collective bargaining and to forestall a constitutional amendment, the Regents adopted policy 5402. Fairly shortly thereafter, as you will see, in January and then again in February, one for each bargaining unit of 2020, we agreed to new language in Article 5 of both agreements, each agreement. And the language of Article 5 was very similar to the language of Regents Policy 5402. So fundamentally, and we'll talk more about the specifics in the ensuing slides, but fundamentally, we went from a situation where we had broad management rights to contract out as long as we were not ending up in job loss, to only being able to contract out in very precise and specific situations, with further requirements about if we were going to contract out, wage and benefit parity, hiring contractors, employees, and some other things, notice requirements. So again, we'll talk more about that in a moment. So next slide, please. So first of all, what are covered services? Basically, covered services are the services within the jurisdiction of AFSCME in the service and in the patient care technical units. And that jurisdiction really derives from the Public Employment Relations Board, PERB, granting a certification to AFSCME to represent employees in certain bargaining units. And actually that certification took place in 1982. So for our purposes today, covered services, the things we are no longer allowed to contract out with various precise exceptions are cleaning, custodial, janitorial, or housekeeping services, food services, laundry services, groundskeeping, building maintenance, but not the kind of building maintenance that our skilled trades would be doing. So somewhat more general and generic building maintenance, transportation and parking services, security services, billing and coding, that would be on the health side, sterile processing also on the health side, hospital or nursing assistant services, and medical imaging or other medical technical services also on the health side. So next slide, please. Now, as I said, there is a specific section of Article 5 that talks about the allowable exceptions. Colloquially, we have referred to those as carve-outs, and they are very precise. So basically, they are emergency situations, and we mean real, legitimate emergency situations where we just don't have the ability to hire someone, bring in a registry person, or something like that. We are currently, the expert knowledge doesn't exist within UCI, or we don't have the equipment available to actually perform the work. If there is a lease of real or personal property, and as Sneha will also testify, this one is a little bit challenging, and I think as well as Sneha and I and some of our colleagues have gotten to understand the requirements of Article 5, this one is still a little bit of a mystery to me because we are, as a system, we're learning as we go. And so we often seek advice from our colleagues at the Office of the General Counsel on this one, unless it's fairly obvious. If the services are of an urgent, temporary, or really occasional nature, where it just doesn't really make sense from an FTE perspective to hire someone. Where if the facility is not within a 10-mile radius of UCI property, and as you can imagine, UCI is a fairly extensive institution with several locations, so we'd have to be careful about the 10-mile radius rule. And then for registry purposes, for clinical staffing needs, there's a specific carve out for that. Yes, thank you. So another rule that emerged from Article 5 is that for any contract for a covered service valued at over $100,000, we must provide AFSCME with notice before entering into the contract, extending a contract that's currently in place, or renewing the contract. Now, Article 5 is very specific about the kind of information that must go in the notice, so we have to provide the duration, the scope of the work, wage and benefit parity information, which I'll talk about in a minute, the dollar value, the location of the work to be performed, and the justification. So one of the previous 6 carve-outs. Now, I don't want you to be worried. My team will absolutely help you draft that notice. We'll make sure that it's served on AFSCME. That's our job, and we will absolutely partner with you on that. Next slide, please. So the other important feature of Article 5 and of the Regents policy is I think in order to have contracting be to disincentivize contracting, if we are continuing to contract out a covered service because we have a legitimate exception or carve out, we are required to ensure that the contractor is paying its employees who are doing our work wage and benefit parity. And the wage and benefit parity rates are provided to us from the system at a system-wide level on an annual basis. And we are required to enter into a wage and benefit parity amendment agreement with the contractor. Now, again, we've got those agreements. We're trying to make this as formulaic and as easy for everybody as possible, but that is a feature to keep in mind. And it's definitely a feature to be discussing with if you are working with a contractor, because they're going to have to understand that the cost of the service will be higher than it used to be. Next slide, please. So the other feature, and I really want to stress this today, I think it's an area where I think we're finally really just getting a sense of the total ramifications of this. So again, one of the big arguments that AFSCME made when we were in bargaining was that many of their members who were UCI employees were working next to a contract worker for 2, 3, 4, 5, 6, 7, 10 years. And the question was, why in the world are these people still contractors? If we really need the service and we're contracting it out for this number of years, we really should be hiring these people. So another important feature of Article 5 is for any contract worker who has worked for us for over 1,000 hours or within a 12-month period, and it's a rolling 12-month period, or for 35% time over a rolling 36-month period, it is our affirmative obligation to offer that person UCI employment. And again, this is something my team will help you with. We'll work with you on it. Your HR professional or the department's HR professional will help work on this. But again, it's something to keep in mind in terms of tracking hours, tracking contract usage. So, sorry, I'm just checking the chat. And if it's okay, I'll maybe pause for this. If a department has an approved exception for a vendor contractor for a few months through, can the vendor be assigned? That's a really good question, Kathy, and I don't actually know the answer. So maybe can we just put this in the parking lot for until we get to the Q&A period, and then maybe someone else will know the answer, or I can find it out for you.
Yeah, let's do that.
Sure. Yep. So Snehal, I think I'm going to turn it back over to you now to talk about the kind of the overall impact.
Yep. Thank you very much, Leslie.
My pleasure.
So I am going to turn off my video. It looks like my internet is unstable. I don't know if you guys had difficulty hearing me or if I was cutting in and out, but I keep getting this message that my internet is unstable. And in order for me not to get kicked out, I'm going to turn off my video. Apologize for that. I typically don't like to do that. But in the world of technology, that's something we got to do once in a while. So after having heard from Leslie what this Article 5 of the Collective Bargaining Agreement and Regents Policy 5402, what it means, I mean, what it is, what does it mean for your department? So bottom line, to the extent possible, we do want to try and utilize our in-house resources for any of the covered services that were listed on the slide that Leslie went over, before we actually look out to contract with an external party. If for some reason we cannot conduct the work in-house and need to contract out, it is imperative that every department make sure that they actually inform employment, enterprise workforce relations, or procurement services before they even consider going out to a third party. It is very important that the departments don't just go out and try to find those outside parties to perform the work and have them do the work. That would go absolutely against the policy and will get us in a lot of trouble for doing so. So please, this is a humble request from all of us, not to go out and ask for somebody else to come and perform services that fall under any of the covered services. We also want to make sure that you all clearly understand that the wage and benefit parity that Leslie talked about, those rates are probably going to be much higher than what you are used to paying any of the contractors in the past. In the past, when the Fair Work, Fair Wage was put in place in 2015, October of 2015, we all were kind of complaining about having to pay the minimum wage of $13 at that point, but $15 since 2017. This numbers will be significantly higher than the Fair Work and Fair Wage amount of $15. So please be aware of that, so that when you have to budget for any of this work, you can take that into account in your budgeting process. As Leslie mentioned, if for whatever reason there is a carve out that allows us to go out and contract the work to somebody else, we have to make sure that we have the wage and benefit parity amendment in place prior to you asking them to perform the service. So, unless it's an emergency where there's going to be disruption in operations and you have to get somebody out there to get the job done, otherwise there will be some catastrophic disaster. That's a different situation that can be explained, and we can go ahead and get the services performed. But on a regular, ongoing basis, you are required to have these documents and amendments in place prior to going out and getting the services performed by an third party. So again, what all this means is you have to think ahead of time. If you're going to be needing services, make sure that you kind of give yourself enough time, you give us enough time to make sure that we can work through any of the issues. Many of you probably have already experienced significant delays in us even getting back to you with any responses, because we are still trying to figure out what carve-out may apply, if it does apply, or if any particular service is actually falling under covered services or not. So even though this policy has been in place for over a year and a half now, essentially because of COVID and nobody having to be working on campus, a lot of these things were not getting impacted. And now that everybody is now back on campus and things are starting to pick up, we may run into a situation that we just didn't think about in the last year and a half. So there is still a lot of things that are being worked out, and I will talk about that also in one of my slides.
Snehal, do you mind if I jump in for 1 second here?
Mm-hmm.
Just a couple of things that occurred to me. So I think two things that I'd just like to point out. And I'm saying this the first one only relatively humorously. So poor planning on the part of a department does not constitute an actual emergency as a carve out. So we want to make sure that we're helping our operational colleagues plan well, so that they're not coming to you saying, oh, it's an emergency. The other thing that I also want to point out is, and I hope this doesn't sound like an excuse, because I'm not feeling like I need to make one, frankly. Part of the delay sometimes is we may have been contracting out a covered service for a very long time, or we may actually not have any UCI employees performing this work. But an issue for all of us, the whole system, is if the work is being performed by anyone in-house at any UC location, then we are subject to that decision, basically. So often what we're doing is we may think, well, no one's ever done it here, no problem, not a covered service. But we are now having to reach out across the system, Snehal to his colleagues, me to mine, and to find out if the work is being done anywhere else. So again, that could be and has been some of the delay. Sorry, Snehal.
Absolutely, Leslie, that's very true. So if you go to the next slide, Doreen. So this is, I just wanted to point out some of the areas exactly to what Doreen is Leslie is just talking about. We actually are still trying to get our arms around some of the services that have been brought up to our attention, and we haven't been able to give a very definitive answer. And I wanted to make sure that we are very transparent. We let people know that that's the situation. We are still not perfect. And so I wanted to give some examples of some of those services that probably could fall into that obscure category where we don't have a clear-cut answer. And just wanted to make sure that you all kind of have a feeling for this, so that when you ask us and we don't have a straight answer for you, you will understand the reason why, exactly to why what Leslie just said, that we have to look across the whole system, across every other campus, to see what's going on. So there's a lot of dialogue and a lot of discussions going on at our level and at a higher level across all the different campuses. So I'll just highlight these 5 that I have here. Indoor plant maintenance. We haven't been able to find a job description that actually clearly identifies this to be on any of the job descriptions. And so we are kind of trying to figure out whether this actually falls under covered services. So at this point, while it's still under review, if somebody does need to get some plant maintenance done on the indoors, we are asking them to go ahead and source it out, but making sure that we actually try to get the wage and benefit parity, if not for something that's known to us, but at least apply something like a groundskeeping or gardener's rate, so that if at all we were questioned, we can say that we at least were trying to do the right thing and implement the wage and benefit parity. Window cleaning is another one that has come up. What the determination that we have made is that anything that is at the low level where somebody can take care of it without having to get any specialized equipment should be performed by in-house staff. But anything that requires any specialized equipment, like higher floors, for example, can be sourced out and is considered to be a non-covered service. Full service catering. This is something that is going to start popping up very regularly now that everybody's back on campus. The determination is that anything that you are catering out where they're just coming in to drop off the food and not performing any additional services is not covered services. But if you need somebody to come in and actually do any serving or do any of those activities, that will fall under covered services. And as of this point, we have not been able to find a carve out or an exception that can be applied to it. There are conversations happening for events that are at a very high level. So for example, if there is any donor event, or if there's a black tie event, or something where we need something that is beyond the capacity of our dining services, that's something that at this point is being looked at as a potential carve out. We also, of course, have to talk to dining services and find out first if they can perform the service and have the capacity to do that. If they come back and let us know that they do not have the capacity and the ability to provide the services that is requested, in that case, we would apply that carve out and the services can be performed so that there's no disruption in services. We have to make sure that the wage and benefit parity, though, is applied if we were to go out and cater this from somebody else. Just to give you an example and to highlight the situation, UC Berkeley actually had a major issue when their chancellor actually sent out a memo asking everybody on campus not to contract out any of the covered services. And they had homecoming that was coming up, that is actually coming up soon. And they are panicking to figure out what are they going to do with catering services for an event that has thousands of folks and very high profile donors who will be coming to it. So, we are not the only ones in this boat. Every campus is struggling with it. I just wanted to give you an example of how, other campuses actually are already facing situations that are very, very precarious. One other area that is currently being looked at across all campuses is pest control. Now, pest control has multiple different activities that take place. And one of the campuses, I won't mention the names, is actually looking at insourcing some of these pest control services. And the fact is that if one campus does it, as Leslie mentioned, every other campus now has to consider that to be a service that has to be brought in-house. So, every pretty on every campus is now getting cognizant of this fact, and there's communication happening at the vice chancellor's levels, trying to understand how do we tackle situations like this. So again, answers some things that we may not have, but we will work through that and try to help you get the job done. Laundry services is another challenging element, because although laundry services falls under covered services, we do not have on our campus the ability to perform this task in-house. We do not have the equipment. We don't have a place to get all these machines and perform this task in-house. So as it stands right now, and things can change down the road, but as it stands right now, we are applying the carve-out for laundry services. However, we have to make sure that the wage and benefit parity is being provided to whoever is going to do these services. That is one of the reasons why we are actually asking departments to utilize our suppliers that we have already contracts in place with. We already have the amendment for wage and benefit parity in place with suppliers like Mission Linen. And also, I believe it's, I'm forgetting the name. Pardon me? Cintas. Cintas, right. So now, so we have at least 2 of those suppliers that you can go to for laundry services. I understand that some of the services that you're requiring are not provided in an efficient manner by either of these companies. So if you have a case like that, you need to reach out to us and work with us to implement a wage and benefit parity with a third company that you may want to utilize before you actually go out and get those services performed. I think by the end of this presentation, if you have been paying attention and listening, we probably would have talked about wage and benefit parity, used that term probably about 50 times. So I would think that you would not forget that when you are done with this, this session. If you go to the next slide, Doreen. Okay, so as I mentioned earlier, the best practice for us is to try and see if we can insource the work. Again, our intentions never have been to take away any jobs of our in-house employees. That has never been the intent. But with these policies now, we have to take even more efforts to try and see if we can bring any of these services in-house. So that should be our very first line of attack, is to try and see if these services can be performed by our own staff. Some of the very easy ones that are not as complicated or obscure are obviously cleaning, custodial, and janitorial services. Facilities management has been very good to work with us. They are our partners, and you can always reach out to them if you need any of the services. I know that we have also had to talk to the budget office and senior management, trying to get them more resources so they can support our campus. Housing facilities, of course, also has housing services, and they also are insourcing all this work for all the housing units. I haven't mentioned housing here, but they know and they manage it in-house. Food services, as I mentioned, you are supposed to reach out to dining services as your first option for any food you want to be catered and serviced. And otherwise, we obviously have our vetted out, approved catering services, caterers that you can use if they're going to just drop off the food. So that's still an allowed service. For any transportation and parking services, now this again is a very broad category. There could be some nuances here, but if you have any questions, you can reach out to either Leslie's team, procurement services, or transportation and distribution services. I talked about laundry services already. Security services is really more about crowd management. That also is one of those areas where we have to be very mindful. You can't just go out and get anybody you want to come and perform those services. Make sure that you work with procurement or enterprise workforce relations. You will see here that we have added UCI Health as another element. Just so many of you may know or not know, we actually have invited folks from health also to come and attend this training session. All of what we have talked about applies equally to both the campus and the medical center and UCI Health. And we have been working closely with Jackie and Susanna Rustad, who is the Chief Procurement Officer for UCI Health, to make sure that we implement these policies and are in compliance. So anybody from health can feel free to reach out to any of these folks. All right, so up until now, all of these activities that comes under covered services have been communicated across different folks through emails. It's not the most efficient process. We have a lot of reporting requirements. We are actually supposed to track all the activities with regards to wage and benefit parity. And we are supposed to keep, as Leslie mentioned, keep track of the hours that our contractors are providing to us. And so obviously across the system, everybody is struggling to put a system in place. So UC Davis actually went ahead and created a form that the departments can fill out that gets routed to the labor relations team and then comes to procurement. So we have adopted that form and we are trying to make a couple of improvements to that form for our use. In fact, there is a conversation happening across all the procurement teams across the 10 campuses to standardize this form so everybody will use the same form. What this form really is to give us some information about your department, your contact information, identify which service you want to get done, and then there is the next page that provides you the option of selecting any of the carve-outs that you think may apply. So you can select that, and then the next page will give you all the time or the space for you to fill out your explanations as to why you think that the carve-out applies, why it cannot be done in-house or cannot be insourced. And of course, there is additional signature blocks at the bottom. And in fact, after you fill out this form, it'll be routed to Enterprise Workforce Relations for them to review it. If they agree to that, they will sign off on it and they will provide the wage and benefit rate that then the supplier has to give to their employees. And it will then come to procurement services and we will then sign off on it. We will help the departments put the amendment in place and we'll keep log and record of our reasoning for allowing a carve out. So this will have a good documented way of keeping track of this. And this forms will then be uploaded to the purchase order. So it's available in the system. I do want to mention that, once we have this in place, you need to understand that when we are asking the suppliers to give their employees the wage and benefit parity rate, they will have their own overheads to apply on top of those rates. So for example, for crowd management and security services, if the rate is $26 or $30, don't expect us to pay the supplier $30, but the supplier has to have their overhead. They have to maintain and manage all the hours that their employees work at our location. They may have to have their payroll manage different pay scales for the same employee when they perform work both at UCI and at some other customer. They also have to pay their share of Social Security and Medicare. And so they will add on top of whatever the rate is, their own overhead. So you will end up paying slightly higher than what the wage and benefit rate is to the supplier. Okay, I wanted to make sure that you all were aware of that and don't just make the assumption that it's the exact rate that we ask them to pay their employees is what you will pay. Next slide, Doreen. Okay, so having said that, again, that form is almost ready. We are trying to finalize it, and very soon, hopefully in October, we will have this form formally released so that and available, we will have this available both on our procurement website and also on the enterprise workforce relations website. So you can go to either place, you'll be able to get this form for you to start filling it out and send that out. And it will be a power form in DocuSign. So it will route automatically after we fill it out to Leslie's team. And from there, it will come to our team. Leslie, now you can talk a little bit about SB 820, which is the latest and greatest hot thing that we have been struggling and spending a lot of our time with.
Thank you, Snehal. Before I move off of this and on to SB 820, I think I was thinking while you were talking, so we've now, since we presented this the last time, we've had another 6 months of experience, and I think we're starting to understand where our gap areas are. Maybe I'll just say it that way. So even though we are obligated by Article 5 to provide notice on contracts valued at over $100,000 on an annual basis, we are actually obligated to provide AFSCME with notice, or we're doing it to OP, but they're providing AFSCME with a master list of any contract for services that are contracted out, even if it's valued at $1. So I cannot stress strongly enough the level of scrutiny that all of the locations are subject to by AFSCME to make sure we're doing the right thing. Well, internally by our executives, by the Office of the President, and by the Regents. And I think one area where we're finding, so it's one thing if your team knows about a contract, and if your team knows about a contract, guaranteed my team's going to know about a contract, and it's easy enough sometimes for us to manage those in terms of compliance. What we're finding out is that some departments, without utilizing your services, and certainly without discussing anything with my team, is still contracting out for covered services. And that is hugely problematic. And, it is causing some perception that we are not trying to comply, which is, again, hugely problematic. So I'm really just saying, please work with your departments to, as Snehal said, please let's utilize the contracts that we have in place that we know are legitimate and justifiable, and so that we have oversight, because we really are going to have problems if there are things out there over which we do not have either any control or any line of sight to. So moving on to SB 820. As of this year, the latest wrinkle or area for consideration is SB 820, which is part of the Education Code, and it deals with the process for the university's capital outlay approval. So commencing with this fiscal year, and for each fiscal year thereafter, probably ad infinitum, SB 820 requires that the Department of Finance approve new and ongoing capital expenditures or capital outlay projects only after UC demonstrates ongoing and continuous compliance with SB 820 requirements. And so next slide, what are SB 820 requirements? Here is the legalese broken down for normal humans. Basically, if a building is receiving capital funding from the state, we must certify, and the certification is actually literally being provided for UCI by Chancellor Gilman. We must certify that since 2017, the building has not contracted out any covered services. Now, fortunately, we are in good shape with respect to our buildings. And if for some reason we had been contracting out for covered services in one of these premises, we would have to report on it in this certification. So next slide, please. So what is a capital expenditure? So what the kind of state funding that we're looking for these properties would be the cost to design, construct, or equip academic facilities for like seismic retrofits, life safety purposes, enrollment growth, modernization, or infrastructure type projects, for debt service, costs to design, construct, equip energy conservation projects at these premises, or to address deferred maintenance. And I mean, obviously, you know, we are a relatively young campus, but you know, one of our colleagues, and that will remain nameless, is about $2 billion in deferred maintenance. So obviously, being able to certify that they have not used contractors for covered services at those premises would be huge. Now, the really important thing about all of this, and if you think I'm trying to scare you, the truth is I am trying to scare you a little bit. While Article 5 has the section for the exceptions or carve-outs, literally there are no exceptions in SB 820. Yes, we have been told, I want to be a little careful how I talk about this. We have been told, although it is not in writing, that if we had a real emergency situation at a building receiving you know, state funding for a capital project, we could address it using contractors without running afoul of SB 820. But I'll tell you, I wouldn't want to test that because it is not in writing. So it is extremely important to understand what these facilities are and to make sure that we are not using contractors to perform covered services at these premises. So I think that's me. I think that's the end of my.
Yes. Thank you very much, Leslie.
Sure.
We cannot re-emphasize enough the importance of SB 820 and compliance to that. As Leslie said, us not being in compliance can have huge implications on us receiving capital funding from the state. And believe me, all the chief financial officers from all the campuses and medical centers across all of UC, including the chancellors and President Ray, all have their eyes on this. And we all are very seriously looking at making sure that we all stay in compliance. My earlier comment about the chancellor at UC Berkeley actually asking everybody to stop contracting out for any covered services across the whole campus was because of this SB 820. I didn't want to mention why, because I wanted you to hear what SB 820 was first. But because Berkeley was not able to certify that all their buildings were being serviced by their in-house employees. And the fact that they could not certify it did not go very well by the Regents. And so Chancellor said, okay, I'm going to take, you know, a very draconian, you know, tactics to make sure that people literally understand the importance and the significance of us staying in compliance. And that's exactly what Leslie was saying, is that we are not trying to scare you, but maybe we are to some extent, just so that you understand that this, you know, if we deviate from this, it will go all the way to the chancellor and up. So I also wanted to make sure that I made a mention that our responsible executive to make sure that we are in compliance with all of this covered services policies is our head of human resources, Ramona Gorella. She is actually our executive responsible to make sure that we are in compliance with these policies. So we now have very regular meetings with Ramona, making sure that she is up to date on what is going on, what are the issues we are running into, whether we are in compliance or not. There have been so many requests coming from UCOP and government relations asking for a lot of data over the last few months that all channeled through Ramona, come to Leslie and me, and then we try to get that information to them. So please don't take this lightly. This is extremely important. We all have to be aware of this, and we all have to work together to make sure that we stay in compliance. So to recap, I know we are running out of time actually. You know, we may not have enough time to cover all the questions, but we will try to do that very, very quickly in a minute. The recap is that we all need to understand what this policy means. If anybody from your department is not attending this session, I kindly request all of you to please spread the word around. Every employee across UCI needs to know this policy and they need to be aware of that. So please spread the word, help us do that. As you heard, the effective date is already in place. This has been in effect for now a year and a half. We need to make sure that we continue to adhere to the policy. Compliance, as I said, is extremely important. This has huge implications on us across the board. As I mentioned, and Leslie mentioned, our chancellor actually had to certify twice this year because they had missed some of the buildings in the first certification. So there was one certification that the chancellor had to give in June, and then there were subsequent buildings that were added to the list, and the chancellor had to certify in late August that all our buildings were sourced internally. And thank you to facilities management and dining services for giving us quick responses. And fortunately enough, as Leslie said, our facilities management has done a fantastic job of making sure that we keep these services in-house. And so a big thank you to all our folks in facilities management to help us with this. Again, there's reporting that needs to happen on an annual basis, but after the issues we ran into with reporting last year, it has been determined that we are going to keep track of all these activities on an ongoing basis, on a continual basis, and we are going to make sure that we start documenting everything we are doing with regards to any exceptions, any carve-outs, any amendments we do on the wage and benefit parity. We are going to keep good record of that on an ongoing basis. So your collaboration on that is greatly appreciated. I think we talked enough about wage and benefit parity. I'm not going to speak to that. And to what Leslie was saying, we have to track the hours that our contractors are working on our site. And the question that will be asked is, who is going to be responsible for tracking those hours? That is something that we don't have a good answer on, but as it stands right now, our understanding is that since the departments are the ones who would know who they are using, who's from an outside company, we are going to ask the departments to take that load of actually keeping track of the hours that they are contracting out, so that, because they are the ones who actually have the understanding and know-how of who they are using. So we are going to ask the departments to track the hours, and we of course are going to ask the suppliers to also provide us with that information on a monthly basis. One other thing I wanted to make sure that everybody understands is that there is going to be a change in the language of the amendment that is actually going to let the suppliers know that UCI reserves the right to actually audit the suppliers. In fact, we may be asking the supplier to use an independent third-party auditor to audit their books, their payroll records, and certify that the supplier indeed paid their employees the wage and benefit parity rates. So, that is an onus that is going to be on the suppliers, that at their expense, they will have to hire an independent contractor to give us certification that they actually met the requirement. So that's coming. That's the addendum amendment that is getting implemented with that additional language. So I think a couple of people had that question, and I think I tried to answer those questions. That is all we had for what we wanted to share with everybody. Here are all the resources that you may want to keep in handy. If you have any questions, we have the links to all the various policies that we talked about today. Enterprise Workforce Relations emails and phone names are here. For procurement services, you can either reach out to Marshall Ng or myself. And when it comes to health sciences, you can reach out to Jackie or Susanna Rosted to answer any questions you may have with any of these policies. Okay.
Great job, Snehal. Thank you everyone for joining. We have a survey. I just entered the link in the chat box there. And I'm going to be now turning off the recording. So give me 1 second and we'll get into the Q&A.
Okay. Before you do that, Doreen, just wanted to let everybody know that we did sign a wage and benefit parity addendum with AB Cleaners for laundry services because they provide those special cleaning services that Cintas and Mission Linen were not able to provide. So AB Cleaners is another supplier that you can actually utilize for some of the laundry services.
Thank you, Snail.